Hello, I'm Jonathan Herland, Interventional Pain Management Physician. My friend Slim and I are here today to talk about radiofrequency denervation. To understand this technique a little bit better, it would be useful if you view the videos on facet joint pain and sacroiliac joint pain that will help to describe to you why we're doing this technique in the first place. The idea, however, is to treat joint pain, sometimes coming from the sacroiliac joint, sometimes coming from the low back facet joints, sometimes thoracic facet joints, and sometimes cervical or neck facet joints. The idea is that these joints have previously been injected and produced pain relief that is only temporary. The placement of needles for radiofrequency denervation for the facet joints is almost identical to the placement of needles for the injection. That is, in the low back, for example, a location immediately below and immediately above this joint. If there are two adjacent joints, then the needle placements are below, in between, and above, and so on. In the neck, for example, the placement of needles are going to be along the side of the spine, like that. And in the thoracic spine, it's a little bit trickier, but it's similar to what we have in the lumbar spine, immediately below and above the joint in question. If we are treating the sacroiliac joint, there are usually 4 needles that are placed. One of them is here at the upper edge of the sacrum, and the other 3 are distributed below. The idea is to accept the fact that the joint in question is inflamed, but rather to interfere with pain signals when they exit the joint before they have an opportunity to reach the brain. Radiofrequency technique is done with a patient awake and responsive, but typically they like to get a little bit of sedation to make the experience a bit less uncomfortable. After radiofrequency denervation is performed, it is typical for there to be 2 or 3 weeks of additional soreness while these small little burns are healing. It typically takes 4 to 6 weeks in order to find out if a good result is going to be gained. Between 50 and 70% of patients who get this technique get relief of 1/2 or more than 1/2 of their pain, and the period of pain relief can be expected to vary between 6 and 18 months. The technique can be repeated as needed. Thank you for watching.